This Embryology Highlights screencast deals with cardiovascular development, presenting in-utero adaptations, the ductus venosus, the ductus arteriosus, and the foramen ovale. The fetal environment in utero is an aqueous one. Suddenly at birth, the newborn must adapt to surviving in the air environment within a matter of minutes. The three adaptations that allow for this adjustment are the ductus arteriosus, the ductus venosus, and the foramen ovale. The ductus arteriosus shunts blood from the pulmonary trunk to the aorta. The ductus venosus is a shunt between the umbilical vein and the hepatic vein to allow the large volume of blood returning from the placenta to bypass liver sinusoids, and the foramen ovale shunts blood from the right atrium to the left atrium. This schematic image of the cardiovascular system shows veins in blue, arteries in red, and the three in utero adaptations are shown in purple: the ductus venosus, the foramen ovale, and the ductus arteriosus. The umbilical vein carries the large volume of blood from the placenta. The ductus venosus allows that blood to bypass the liver sinusoids and get transported directly back toward the heart. The foramen ovale allows the large volume of blood that's entering the right atrium to be shared with the left atrium by passing through this foramen ovale in the interatrial septum. The ductus arteriosus shifts blood away from the lungs to the general circulation. Suddenly at birth, blood flow from the placenta ceases, and the ductus venosus gradually closes over a period of days. Increased bradykinin and oxygen tension and decreased prostaglandins from the placenta trigger an immediate contraction of the ductus arteriosus, and gradually this becomes a fibrous ligamentum arteriosum. The foramen ovale closes as blood pressure equilibrates in the two atria, and eventually the closure grows so it is permanent. This image compares fetal circulation with neonatal circulations. The red is highly oxygenated blood, and the blue is less oxygenated blood, or least oxygenated. On the left, this fetal arrangement is shown. Blood coming from the placenta is shunted through the liver and ends up in the right atrium. The large volume of blood arriving at the right atrium is shared with the left atrium through the foramen ovale. Blood pumped from the right ventricle through the pulmonary trunk bypasses the lungs via the ductus arteriosus, which allows that blood to join the systemic circulation in the aorta. So these are the adaptations for an aqueous environment where the lungs are limited in their capacity to receive blood. But the two ventricles have to pump the same volume of blood because the two circulations are in series. So the pulmonary circulation is in series with the systemic circulation. On the right, the postnatal circulation arrangement is shown. A placenta is gone, and the liver sinusoids are processing blood flow from the gut. That venous return joins the rest of the return from systemic circulation and goes to the right atrium. The right and left atria are completely separated by a solid interatrial septum. All of the blood pumped by the right ventricle through the pulmonary trunk goes to the lungs. And so there's an increased amount of blood returning from the lungs then into the left atrium. Both 8 ventricles have to pump the same volume of blood because the two circulations are in series. The pulmonary circulation is in series with the systemic circulation, the two ventricles do not pump equal volumes of blood, then blood would pile up either in the lungs or in the systemic circulation. Although the volumes are equal, the pressures are quite different. The left ventricle has a much more resistance, and so it pumps at a much higher pressure than the right ventricle does. This text summarizes the in-utero adaptations. The ductus arteriosus shunts blood from the pulmonary trunk to the aorta. The shunt allows the right ventricle to be exercised in the face of limited capacity of the lungs to accept blood. At birth, constriction of the ductus arteriosus abruptly shifts pulmonary trunk output to the lungs. So now the lungs are getting all of the blood pumped by the right ventricle. Eventually, the ligamentum arteriosum replaces the ductus arteriosus as the duct becomes a fibrous structure. If, however, there is a persistent ductus arteriosus, that is, it does not close, then one can hear a continuous murmur both during systole and diastole. This can impair circulatory efficiency depending on the size of the opening. Another adaptation is the ductus venosus. This is a shunt between the umbilical vein and the hepatic vein that allows the large volume of blood returning from the placenta to bypass liver sinusoids. There's no need for the liver to detoxify fetal blood because that function is taken care of by the maternal liver. A persistent ductus venosus, known as a portosystemic shunt, can lead to neurological signs because it allows blood coming from the stomach and intestines to bypass the liver sinusoids so they are not detoxified by the liver and they go directly into the venous circulation. And finally, the foramen ovale shunts blood from the right atrium to the left atrium, providing blood for the left ventricle to pump into the aorta. A large volume of blood is entering the right atrium because that is receiving blood from the placenta, but little blood is entering the left atrium because the lungs cannot accommodate a large blood flow, and so they have very little to return to the left atrium. Postnatally, however, when the lungs are receiving the same amount of blood as the body circulation, and they are returning that blood to the left atrium, and meanwhile the absence of a placenta decreases the blood flow to the right atrium, the two atria equilibrate in pressure, and the foramen ovale then closes, and eventually it grows closed. This concludes this Embryology Highlights screencast dealing with in-utero adaptations of the cardiovascular system, the ductus venosus, the ductus arteriosus, and the foramen ovale.